Greetings. How's everyone doing today? I'm Sanjiv Chopra. I'm a professor of medicine at Harvard Medical School, and I'm privileged to be your host today in our third segment entitled Know Your Health. And I'm delighted to welcome our guest today, Dr. Christine Runyan. She's a professor in the Department of Family Medicine and Community Health at the University of Massachusetts School of Medicine. For more than 2 decades, she's been teaching and practicing, and she's a very renowned clinical psychologist. And we look forward to hearing from her during this COVID pandemic. So welcome, Dr. Runyan.
Thank you so much. It's a pleasure to be here. It's a privilege, really.
Terrific. So, Christine, I wanted to start by saying, what is the prevalence of these two major disorders that can sap the energy out of all of us, anxiety and depression, in so-called normal times?
Mm-hmm.
And has there been a change? Has there been an increase during this global pandemic?
So I'll do my best to answer that question related to change, although the data, as you might imagine, is fairly emergent and recent in how we're trying to understand this. So anxiety and depression are two of the most common mental health conditions that affect all humans, so not just Americans, sort of across the globe. In fact, depression is the leading cause of mental health disability in the globe, around the globe. And so in normal times, rates of depression, depending on where you're accessing the information in terms of the general population or in medical settings and primary care. So there's always some variability around the numbers. But in general, the rates of depression, let's say if you're going to just look in like in a primary care setting, really hover upward around like 18 to 20%. And pretty much the same is true of the different types of anxiety disorders. In the time of the pandemic, it does look like these rates are higher, although we don't have the same quality of data in terms of really looking at diagnostic rates. When people are looking at population level prevalence of anxiety and depression right now, they're really doing it through some core screener questions to see if people answer positive to these screening questions, which are a couple of questions for anxiety and a couple of questions for depression. Now, whether those translate to what we would consider mental health disorders that go along with a panoply of other symptoms that go along with some level of impairment, we don't quite know. But the rates at the surface, if you look at stress, anxiety, depression, are really bumping up over 30% of the population from what we can tell from the studies that are out there now. So it does look, not surprisingly so, that the pandemic and all of the sequelae from the pandemic in terms of high levels of uncertainty around people's physical health and susceptibility to illness, concern about family and friends being sick, and then the vast changes that have happened to our society and the social structure that really are so supportive for all of us in terms of our mental well-being, in terms of routine, in terms of school, socializing, connection. All of those things really stop pretty abruptly and have been going on for months now. We're coming 10 months through this pandemic. So not surprisingly, we're seeing all of those numbers. It looks like at a population level climb, even though we can't say for sure. We know that that translates to actual diagnoses.
Yeah, and I think that terrific. I think most of us also look for some pattern of routine. Mm-hmm. And right now there's so much uncertainty as to what's going to happen with this pandemic. When will life ever be normal again? Will it be a year or even longer from now? I think there's a good glimmer of hope now with 2 vaccines that they're telling us are 90 to 95% protective. That'll be amazing. It'll be wonderful if the track record, when it's released and used in millions of individuals, is as good. Sir William Osler once said the best time to use a new drug is right away while it's still working. So we should get this vaccine out right away, the two vaccines. I think that might make a difference, right? When people feel, okay, there's a little bit more control. I might be able to go to work. I may go out and meet a few friends.
Yeah. I think you really nailed what I think is really at the epicenter of these rising rates and concern about mental health, which is fear and uncertainty, and how that actually disrupts our nervous system. Our nervous systems are quite sort of precious and sensitive, living inside of us, and they are constantly attuned to looking for and keeping us protected from threat. And that is a brilliant design that lives within all of us to keep us safe and, frankly, to keep us alive. And so our nervous systems are really detecting this threat that's in the air. It's an invisible threat. You can't see it and you can't necessarily know it. And so for most of us, we are operating at an amplified state of cautiousness and of vigilance. And that really keeps our stress response that, again, is exquisitely designed to keep us safe. And it's ramping up for all of us. And anxiety is essentially a disruption of that nervous system.
Yeah.
And so even just this hope of these two potential companies who are reporting good early results about the vaccine, I think you can probably, if we could measure it, you sort of could feel people settling a bit at the possibility of that. And so I think what you pointed to is really what's at the heart of the worsening mental health crisis that I think it's fair to say that we're probably in as well, is that amplification of the stress response. And so that's really true of anxiety. And when that goes on for a long period of time in your system, you do have an allostatic load, if you will. You have your system is forced to handle too much for too long at too high a level of intensity. And so you get some breakdown in that. And that's where you're seeing, I think, the effects of on depression. And you're seeing people really sort of contract and lose, having some isolation and lose the connection and lose the routines that really keep people feeling safe and engaged in the world.
Yeah. Terrific. Christine, are there any gender differences, ethnic differences, a little bit about demographics of anxiety and depression? Are there certain cultures where it might be taboo to say I'm depressed?
Yeah.
Are depressed, but it's not macho.
So I think particularly with the numbers we're seeing in the pandemic, you probably are seeing a little bit more equalization of this, but still you do see higher rates of depression in women compared to men. I do have some concern about that related to what that might look like with the economic downturn. If you look at sort of mapping this crisis onto kind of what we saw after 2008, you did see quite a spike in depression and even attempts of suicide and suicide rates in men, particularly men kind of in 20 to 50 range, probably having a lot to do with that sense of purpose, sense of meaning, sense of obligation. So that kind of remains to be seen. But in general, you do see some higher rates in women. And the two age groups that I think are being talked about a lot right now is sort of that the population that is the worker population. So maybe 25 to 45, you're seeing some increased rates. And then the teens. Real concern about adolescents, which again, if you think about all the things that have been disrupted and their job, really like sort of their developmental job right now is really built on social connection and identity formation, and the way that they figure out who they are is as much as figuring out who they're not. And so much of that has really been taken away from adolescents and young adults. And so I think there's a lot of reason to be concerned about increased rates in that group. There doesn't seem to be, at least at this point, data that suggests that suicide rates are up. That is always contingent upon, getting that data from vital statistics and from kind of knowing cause of death. And so there's always sort of a delay in that. And I don't think we have good data around attempts yet.
Okay.
So there's still lots of reason to be, I think to be concerned. It's been really heartwarming to see how much, as a mental health clinician, to see how much attention is being paid to this. Now in the popular press, I think, and healthcare organizations really paying attention to this crisis among health professionals, which is an area of focus of mine, of how do we care for the mental health needs for health professionals that are being asked to do so much right now and do it quite selflessly. So I think we're still, there's still a lot that we don't know, but it is nice to see, I think, some national attention being paid to mental health in a way that, perhaps only a pandemic can can do. And it normalizes the language, like you said, that people can talk about these terms or ask questions or asking people how they're doing in terms of their mood or how they're doing in terms of, are they feeling down or depressed? And that's no longer feeling like such taboo language.
Yeah. I looked at a cover story in Forbes magazine recently, and it had 7 of the most amazing leaders around the world who have tackled the COVID crisis the best. Mm-hmm. And they were the leaders from Iceland, Finland, Norway, Denmark, Vietnam, Germany, and New Zealand. And what's amazing, they're all women leaders, right? They're much more nurturing and caring.
Yeah.
And Jacinda Ardern from New Zealand, who's been nominated last 2 years for the Nobel Peace Prize and will certainly get it one of these years soon, I think is one of the most amazing leaders in the world. And they are addressing mental health problems. Mm-hmm. They're going to a 4-day week. Mm-hmm. And she, for a small country, has invested a few $1 billion in addressing mental health in young people. Yeah. Don't wait for them to become teenagers and young adults. Tackle it. So social workers, psychologists, teachers, parents, all being trained. What a visionary way to address this.
Yeah, I mean, we do have good science now to suggest what are the ways in which we can prevent a lot of mental health issues, both kind of contextually, environmentally, as well as internally. And what are the skills that we need to be able to do that? And how do we put those into sort of our expected routine?
I want you to comment on that. So what is the role of vitamin D, exercise, the social fabric, gratitude, mm-hmm. meditation, 3 or 4 things?
Yeah, when I think about I would say high yield coping is also high yield prevention. And I think about a lot of this at the level of the nervous system. If I could just do an aside about not being surprised around the types of leadership that has been so helpful and effective at this time of the pandemic, because our nervous system is also, we're social primates, and we have part of our nervous system is built around what would be called tend and befriend. And to recognize that our nervous system quiets down when we are in cooperation, when we are in connection, and when we feel tended to, and it allows us to feel compassionate towards. And so it's interesting that recognition of that is the kind of leadership that actually can affect at such a large population level. And I think it has to do with that settling in the nervous system. So I just had to say that as an aside. And then in terms of high prevention, high coping, certainly exercise is a big one, because you again, are working at the level of your physiology, and you're allowing your brain to produce, high yield hormone and chemicals that help improve our mood in terms of dopamine, for instance. Gratitude and savoring. So our nervous system doesn't need any help looking for the negative. It doesn't need any help finding the stress in our day. But it actually does need some help. And we have to incline the mind to look towards things moment by moment that we are really enjoying or really present with. When we can have our full attention on something and be fully present, it really most often moves out of the sense of neutrality and it goes to something quite pleasant and enjoyable. So if we can savor and have gratitude for those things in our lives, that again works at the level of our physiology, releases dopamine, releases oxytocin. So those things for sure. Social connection is a big one, and social connection looks so different for all of us now, but it doesn't, this mind body doesn't know a whole lot between the difference between real and imagined necessarily. It doesn't know a lot of the difference between how can we create that connection using technology, masking and using social distance to be able to have some physical presence for people. So any ways to get at connection, but that also includes connection with self. Actually, we can be in relationship with ourself in a way that can be really nurturing also. Sleep is actually a big one in terms of prevention and coping. Sleep is really thinking about going to a 4-day work week or doing things that really pay attention to not allowing people to work, overtime shifts. This is really something in the healthcare field where staffing is really critical right now, but proactively putting limits on that, because sleep is where we rest and we rejuvenate at all levels, and really at a cellular level where our memory consolidates and we can sort of manage the times that we're living in. So sometimes, even though we may not be as active, our sleep needs right now may actually be greater. And to whatever extent we can honor those, that will be very high yield coping as well. I'm a mindfulness teacher as well. So anything related to mindfulness and meditation, again, it really works at the level of the nervous system and increasing our own self-awareness so that we know the kinds of things that are unhelpful for us, and we can move away from those as best we can and move towards the things that are helpful for us. It just really dials up that level of self-awareness.
Terrific. What about vitamin D?
Well, so as a clinical psychologist, I don't want to overstep my scope of practice in terms of vitamin D, but I do happen to live in New England, and so I think for anybody who's living fairly north, where your exposure to natural sunlight is limited, I am a very faithful connoisseur of vitamin D myself, and just to recognize that we all have limited access to that vital source that really is helpful for regulating our sleep-wake cycle and regulating our mood.
Terrific. I think in closing, I want to really thank you for sharing your insights and wisdom. But I was also reflecting on what we can learn from children. So I'm so happy to be the grandfather of 2 amazing granddaughters who live in New York, but I talk to them all the time, and they're 14 and 16. But the younger one, Mira, when she was about 7 years of age, they were visiting Boston. We were about to sit down for dinner, and she says, Nana, which means maternal grandfather, we're going to play a quick game today. We do it every night in New York before dinner. So I said, okay, what's up? She said, it's called Thorns, Buds, and Roses. I said, I don't know what that means. She said, I'll explain. She said, my thorn for today is my cousin was coming for a play date, but her father got busy and couldn't bring her. Thorn, negative. My bud is she's coming tomorrow. And my roses are, you took me this morning for breakfast, then you took me to Barnes and Nobles, and you got me 3 books. And then tonight after dinner, Nana, you're going to tell us some stories. You're a pretty good storyteller. So the ratio of 3-1 for positive versus negative thoughts.
Yeah.
Negative thoughts are so heavily weighted.
Mhm.
And it took 2 minutes to go around the room between the 6 of us sitting down for dinner. And it's something I think the kids can do. They can improvise and they can
Yeah.
play games. It's such an easy thing to do.
Yeah, I love that because it doesn't ignore. It's not just being very Pollyanna and pretending we don't have this, pandemic to manage, or it's not ignoring that for all of us, right? The itinerary meets reality, and
Yeah.
here it is. Like here's something that's not so pleasant, and look at these other things too that are also here, and our mind needs some help doing that. And a 3-1 is sort of the ratio that's talked about in positive psychology.
Yeah,
and it's that ratio because those negative things are so sticky, like they stick around, so we do have to balance it. Yeah, I love that.
Yeah, for the people listening, it's called the Losada ratio, named after Marcel Losada, an economist. And 3 to 6 is ideal. Less than 3, you're in the danger zone. And actually, if it's more than 11, positive to negative, it's also in the danger zone.
Yeah.
And my speculation are perhaps those are people who are manic and they haven't been diagnosed and treated yet.
Right.
So with that, we'll finish. And again, I want to thank you so much for sharing your insights and wisdom.
Oh, my pleasure. Thank you for paying such close attention to the health and well-being of all people, and particularly in terms of mental and emotional health.
Great. Thank you.